That's quite a few people in, so I'm sure there'll be a couple more come in as we start, but we'll make a start. So welcome everyone to this Farm Advisory Service funded webinar tonight. My name is Cara Campbell. I'm a consultant down in the Campbelltown office over in west of Scotland. Tonight we've got Megan Fergusson, who is one of our vets at SRUC. And she is going to be discussing the Preparing for Sustainable Farming funding and what's in it for sheep keepers in terms of the animal health and welfare interventions. So I'll hand over to you, Megan.
Thanks very much, Cara. Hello, good evening, everyone, and thanks very much for joining us. This is part of a sort of two series webinar. So my colleague did one last week on what's in it for cattle keepers, and this is the second one. We're going to talk about the sheep options within the Preparing for Sustainable Farming funding that's available at the moment. So the cattle one will be available for catch up. I'm sure Cara will tell you at the end where you can find it. This one will also be recorded, so if you have friends that have signed up that didn't make it, then they can listen back at a later date. So yeah, my name's Megan Fergusson. I'm one of the vets who work for SRUC, and that's why I'm here tonight, because this is the sort of animal health and welfare module of the Preparing for Sustainable Farming funding that's been made available for us to use. And hopefully I'm going to go through what it all is, what it entails, and I want you all to go home tonight with some ideas of how you can use this for your business, because it's there, it's available, it's to be used. So yeah, I'll go through all the options with you, and you can sort of think as we go through, how does this apply to my business? How can I use this? Because as I say, it's there to be used, so please do. So let's kick off on my next slide. If you've got any questions, then I'm sure there's a chat box at the side. Is that right, Cara, for people to put them in as we go along?
Yes, I forgot to say before you started, if you've got any questions as Megan's talking, please pop them in the Q&A box, which it should be along the bottom of your screen. Okay.
Yep, and that includes if you can't make out my quick Ayrshire accent, then please pop it in and we can come back to anything and clarify at the end. So the Preparing for Sustainable Farming, it's a bit of a mouthful, PSF we'll call it. So funding's been available for carbon audits, soil sampling, etc. And as part of one of those branches, animal health and welfare is another one, and the funding for the animal health and welfare branch is available for last year, 2023, and for this year. And that's just a screenshot of the website there, where you go on to do your claims, and there's all the information that we're going to tell you about is on there, as well as the other modules that are available to claim for. So if you just Google Preparing for Sustainable Farming funding, ScotGov, then it'll bring it all up and it's all there for you to see. But hopefully, events like this sort of break it down into more sizable chunks, and actually discuss it rather than just reading it, what can be quite a dry document. So why is this funding available? Why has the government done this? So yeah, Scotland aiming to become a global leader in sustainable and regenerative agriculture. Now, what does that actually mean? So they're trying to push for improved animal health, because this will lead to better production. So we're talking about better live weight gains, lower losses, because that all pushes to make farms more efficient. So for every animal that's on the ground on a farm, it is producing more kilo of meat or more milk, or whatever the end game is. And for every animal that we can make more efficient, then there's lower greenhouse gas emissions associated with that animal. Part of the funding is to encourage keepers that are maybe less engaged in really pushing to become really efficient, but also we want to really reward those that are already doing it. So if you're already doing these things, you're not going to be at a disadvantage, because you can still make these claims and get the funding for it. So in practical terms, what's in it for you? So if you haven't previously claimed last year, you can get up to £750 this year. That is for 2 interventions you can claim for, and then there's another £250 that's claimable on top of that, for your own personal development and we'll come on to that in a little bit. But yeah, it's a really good opportunity to get advisors involved, whether they be like agricultural consultants, feed advisors, your vet. Just look at your business, look at from an animal health point of view, assess the current risks, identify what might be a risk in the future. Are you thinking about changing your business model? Are you going to be buying in more stock? Would you like to close your flock to sort of reduce the disease risks? What can we do to mitigate any risk of, if you've got, new neighbours bringing stock on to neighbour yours, or if you're sending animals away to wintering or something, what can we do to mitigate and sort of reduce the risk of disease coming back onto your flock? And yeah, all of these discussions with all your advisors feed into your health and flock health plan as well. And this is all things that a lot of the time we'd love to be doing, but it takes time, and time is money. But this is the funding available for you to sort of do that. So this is the opportunity you have to actually sit down and say, right, we are going to sort this out this year. Let's use this funding, and see how much more efficient you can make your flock by using it. So in practical terms, that's what you're getting money wise. And what can you use this money towards? So this is just a screenshot from the website. There are 9 options to choose from. Now the top 4 there, I'm not expecting you to be able to read this slide, I realise it's quite small. The top 4 there are all the cattle ones that were discussed in the last webinar. So we are going to discuss the bottom 5 that are to do with sheep in this webinar. So namely there we've got sheep scab, sheep iceberg diseases, lameness, liver flake and roundworms. So they are the 5 categories that the government have identified would be useful for people to review on their farm, and here's money available to review it. And could you reduce any of these things on your farm? Could you improve them? And as a consequence, improve your growth rate, reduce your losses, and just improve efficiency overall. We're always looking for feedback on these choices. Obviously, these are the options for this year. But if there's anything you're thinking, that really should be in there, then we're always open to hearing back. We can feed that back to the Scottish Government. They are, open to feedback as well. So if there's something not on that list that you're thinking, I'd really like funding to do that, then yeah, mention it to your local advisor, send us an email, and we can feed that back as well. So what we're going to do now is we'll go through these individually, and I hope somewhere when I'm chatting, a little light bulb will go on and think, yeah, actually, that would be useful to me. Let's do that. So as I said previously, you can get £250 per intervention, and you can claim for 2 interventions. So you can claim for a cattle one and a sheep one, or you can claim for 2 cattle, or you can claim for 2 sheep. It's just up to 2 in the year. And then you get your additional £250 added to the first claim. So if you claimed last year, you won't be eligible for that this year. But if you haven't claimed at all, then you will be eligible for that additional £250. And that funding is aimed at allowing you to, go for a day CPD or something, or, go to a farm visit, go to a workshop or something, just to sort of increase your knowledge and network, and yeah, hopefully bring something else back to your farm that you can sort of improve efficiency with. And if you did claim last year, you can claim the same interventions again, or you can claim different ones. So it's up to you what fits best. So it might be that you concentrated on something last year with your vet, and you're thinking, right, okay, we're going to continue that, but let's use this funding to do something different this year. So the £250 per intervention is a standard payment, regardless of your size of flock. So, people with a lot of headage aren't going to be getting any more than smaller flocks. So it's sort of the same across the board. You have to do the investigation and complete your actions by the end of the claim year. And the claim has to be submitted by the end of February the following year. So the end of February 2025 is when these have to be submitted. So yeah, depending on whether you claimed last year or not, you'll either have £500 or £750 available for this year. And it is actually like free money. There's no strings attached to it. You just have to decide what you're going to use it for and put in your claim and show that you've used this money to increase efficiency on your farm. There's no audits attached to it. There's no inspections attached to it. So don't be worrying about anything like that. So practically, how do you actually do this? On the website, there is a form, just an online form. So it's just an online portal. You don't even need specific details about exactly what you spent the money on. So they don't need costings of, how much of that £250 you've spent. Like I say, there's no on-farm inspections triggered. And it's one form per intervention that you need. So you would need, if you're doing 2 interventions, you need to submit 2 forms. And basically just fill in what option you've chosen, the date of it, what the outcome was, and you need an expert advisor to sign it off, which would usually be your vet if you consulted your vet on the matter, or done some testing through them, discussed what you should do. Then they would sign it off. And yeah, you just have to have that signed and submitted by the end of February next year. And yeah, you'll get the funding for what you've done. Okay, so let's get on to some vet stuff now. So these are the options. We're going to go through them individually. And like I say, hopefully a little light bulb might go on and you think, let's do that. That sounds really good. So the first one I'm going to talk about is sheep scab. So the funding is available to screen 12 animals per management group, or all the animals if they are, if there's less than 12 in the group, to determine the sheep scab status of the whole flock. Now, someone really clever, much cleverer than me, has done the sums, and they reckon that of a population, if you sample 12 sheep, you'll get a really good idea of what's going on in that whole group of sheep. It can vary what you determine a group as. Obviously, they'll have to have been together for a little while. But a lot of people won't have any experience of blood testing for scab. So this is scab as we know it. It's every sheep farmer's dread. Hate seeing sheep like this. Obviously, really itchy, losing wool. They don't do, they lose weight, the lambs don't grow. So this is the stage we want to avoid getting to. We don't want them to get to a clinical stage. When they are at this clinical stage, the traditional way to diagnose sheep scab would be to actually just take skin scrapes from the wool and look for the mites. So that's a sheep scab mite there. And when they're at this stage, it's really quite easy to find mites. But we want to catch them before they get to this stage, before they're losing condition. So how do we do that? If you've got a sheep that is not at the really, really itchy stage, but you're suspicious you might have scab, it's really, really sometimes really hard to find mites on it. You can take multiple scrapes, but if she's not got any obvious lesions, then it's really, really hard sometimes to actually see a mite and diagnose it. So there's a blood sample being developed. So it's called the sheep scab ELISA. Some of you might have heard of it. It's been going a few years now. And basically it tests for exposure to sheep scab. So the actual infection takes a little while to take hold, like a couple of mites will become established, and it takes them a little while for the skin to react and then for the wool to fall out and you to see that. But this blood test can test for exposure 2 weeks after those mites have, first gone on, and that as well before you'll see the clinical signs. So it's a really good tool to assess a group and think, right, should I be treating these or not? Should I dip them? And the advice for sheep scab would always be, if in doubt, just dip them. If in doubt, we need to get them treated. That's not always practical, and we appreciate that. So the blood test is a really good way to assess if they've been exposed or not. So, if you've got a group that have been away at wintering and come back, and it's really not a practical time of year for you to be dipping them, maybe they're heavy in lamb or something. If you blood test 12 out that group and they're all negative, then that gives us, a bit more reassurance that they've not been exposed to scab when they've been away. Another time you might use it is if you're like buying in tups. There is some question that you should always quarantine them and treat them anyway, but again, if that's not practical, a happy medium would be to do this blood test. So you can use this funding towards that. It's important that you do know the history of the sheep you're sampling, because they can remain positive for some time after they've been treated successfully. So you might have a group that have had scab, and they were, dipped or treated in some way, and they're clear now. But if you test them on the blood sample, maybe, a few months later, they might still test positive because they have been exposed recently. So it's quite important that you know that history when you're doing the sampling. So for that reason, it's probably most suitable for groups that you've got at home. You know their history. Maybe you've got some away on a hill that have maybe been in contact with neighbour sheep, but when you bring them off the hill, you just want to check they've not been exposed. That would be a good time to use it. So you can use your funding towards this. Like I say, it's 12 per management group that you want to test, and it's a really simple blood test. Just one little blood tube off of each sheep, and yeah, it just gives you a really good idea of whether they've been exposed to scab or not, and it can inform your treatment decisions. So yeah, good one to remember. Really good one to have funding for, to be honest. Right, moving on to the next option for sheep, we've got what we call sheep iceberg diseases. So sheep iceberg diseases is a sort of umbrella term, and under that umbrella, I'm going to talk about them individually. So we've got mydevisna, Johne's disease, border disease, CLA, and OPA. And that's a lot of diseases in there, and you'll be thinking, God, surely I can't have all them in my flock. But if you don't test, then you don't know what you've got, and this is a really, really good way to test and see what you've got. So the funding's available for you to discuss with your vet, right? How do I know if I've got XYZ in the flock, and what can I do about it? So iceberg diseases, like I say, it's an umbrella term for all these diseases that we're about to discuss, but we call them iceberg diseases because when you see a clinical case on farm, so for example, you might have a case of OPA where you've got a ewe and an older ewe in poor condition, she's struggling to keep up with the rest, and we might diagnose OPA in that sheep. For that one case, there's going to be a lot more that aren't as bad as that, but it is affecting their growth rates. It is affecting how much milk they're producing for their lambs. Same with Johne's disease. You could have one that goes really, really skinny. So you think, oh, what's wrong with her? You investigate it, you diagnose Johne's disease. You will have, another 10, 20, 30%, I don't know how many, under her that haven't become clinical. So they've not become really skinny. It's not affected them outwardly how you see them, but it is affecting their ability to milk or to grow. And some of these diseases, we always sort of think them as affecting older ewes because they've got, a longer incubation period, so they'll catch them as lambs and they do fine, and then, as they get older, the disease catches up with them. But in the post-mortem room, on a day-to-day basis, we are diagnosing things like OPA and Johne's in younger and younger animals. We're getting, hogs in that are clinical and have these diseases, so they're not always associated with older ewes. And basically they will just be about on your farm if they're there, and they really will be affecting growth rates, milk production, increased losses as well. If you've got ewes with OPA, or even not enough OPA that's going to kill them, but a bacterial pneumonia on top of that, like a pasteurella pneumonia on top of that, will kill them. So you want to keep these things to a minimum, because you want you don't want your hogs that you've reared as your replacement ewes to be that, you don't want to lose them at that stage. You want them to be in your flock for as long as they possibly can be, and you also want them to leave as a valuable animal as well. You want to get your cast money for them. You don't want to have to put them away to us for postmortems or on the dead lorry. You want them to leave the farm with a value as well. And all these iceberg diseases prevent that from happening, and that affects the efficiency of the farm. Also, really importantly, it affects your bottom line. So if these diseases are there, it's really important for you to know about it, and so maybe tweak your culling policy or something with that regards. So let's look at them individually because it's easier to explain them individually. So this here is a picture of a ewe with OPA, which is ovine pulmonary adenocarcinoma, otherwise known as Yaxete. A lot of people will know it as Yaxete. And this is the classic wheelbarrow test where you lift the ewe up by her back legs and fluid will pour from her nose. It's not at all recommended to be doing because it's really not welfare friendly. It would only generally be done. Well, we see them in the post-mortem room when they're dead, and we hang them up to weigh them or whatever, and we get lots of fluid out their nose. But that fluid is all sitting on our lungs, basically. That's where that's come from. And the lungs. So this is the sheep's lungs, and you can see here. That's the windpipe going up the top there. I don't know if you can see my pointer, but the windpipe, it's got a lot of foam in it there. And that foam is coming from the lungs. Those lungs are full of foam. And I don't know if you can see, but there is I'll see if I can get a pointer here. Here we go, there's a pointer. So we've got a little margin of demarcation here. So this here on top, this is normal lung tissue, and all of this is tumour. So that lung tissue has gradually turned into tumour, and all those little tumourous cells produce fluid, and our lungs fill up with fluid, and that's what eventually comes out our nose. A lot of people will suspect this when they find dead ewes and they've got a lot of fluid out their nose, and that can sometimes be the case. But basically, this is a disease that's contracted as a young lamb, so they'll pick it up as a young lamb. And it does have a long incubation period, so it can be sort of 2 to 4 years before they develop these lesions. But these are the ewes that when you're gathering them, they hang at the back, or they sit down. You have to end up putting them on the bike to get them in. That would be the classic presentation of an OPA ewe. And like I say, they either eventually die or they get like a Pasteurella pneumonia on top of this, and it kills them. And we are diagnosing this in younger lambs. And obviously the younger they die out, the flock is a bigger loss. So yeah, basically you don't want this in your flock. If you've not got it, you don't want to buy it in. And if you're selling breeding animals, ideally you don't want to be passing it on to anyone else. And that's the cross section of the lung there. So that's the lung that's been cut into, and you can see here the pink bit is nice, fresh, like that's normal lung. The air will be flowing in and out of that. And the white bit here is all what we call consolidated, that's tumour. There will be no air going in and out of that, so that's why she's really, really struggling to breathe. So unfortunately, we don't have a nice blood test to test for OPA. There isn't such a thing available yet. The two main ways to screen for OPA is, as a lot of people are starting to scan lungs as a screening tool. So that doesn't diagnose it. It will let you know that there are suspicious animals. The only way to definitively diagnose it is to actually get a sample of lung and look at it under the microscope. That's the only way to definitively diagnose OPA. But you can use your funding towards that. So I'll talk about cull ewe screens after all these diseases, but if you've got ewes that are skinny for no obvious reason, then they are good ones to send in for post-mortem. Because they're skinny, they're not going to gain weight, so they're not going to be a high cull value anyway. You might as well sacrifice them to investigate why they're skinny, what's going on there. And if you are buying in any stock, then like I say, a lot of breeders are now scanning for OPA and will advertise their stock as scanned OPA free for X many years, and that's what that means. So yeah, it's one that you don't want to be buying in. And yeah, you can use your funding to see if it is in your flock, and if it is in your flock, there are control measures you can put in place. One of them being that some people will just cull a bit earlier, rather than letting them get to the really skinny stage, where their cull value is just dropped. Then just keep a younger, fresher flock is a good way of stopping it being such an issue. Because you're still getting a good value for your cull animal then, and you're not letting them get sick, and you're hopefully limiting losses by it. But you also have to shut the door at the other side and not let it come in either. Right, so more lungs. So a lot of these iceberg diseases are lung orientated in sheep. So these lungs are from a sheep that had Mydivizna. So Mydivizna, I think it's Icelandic. Mydi, yeah, I'm sure it's Icelandic. And basically it's a wasting disease of sheep. And again, it's got a long incubation period, so they'll pick it up as lambs. And it eventually causes increased pneumonia. So these lungs are really inflated. So you can see that there's impressions of the ribs on these lungs because they're so blown up. And because they've done that, you would have a real shortness of breath and be really struggling. It can also cause some forms of arthritis and wasting, mastitis as well. Often the first indication of MV in a flock is the ewes just have no milk for their lambs. And we've had flocks in the past where they've just spent an absolute fortune on artificial milk because the ewes have no milk, and it's because they've got MV. So again, it's one that you don't, if you don't have, you don't want to get, you want to keep it out. But in a lot of flocks, there will be a low level of all these diseases floating about. But if you've not done any testing, then you won't know what's in your flock. So it would be really good to use this funding to do some testing and just put some control points in place. Think, right, okay, we've got, a few tested positive for MV here. How can we stop that getting any worse in the flock? Do we just get rid of them? Where have they come from? Are they homebred? Did we buy them in? That sort of thing. And all of this is totally individual to your flock. So yeah, you need to get your vet involved and discuss it. So that's MV. Luckily, there is a blood test for MV, so we can do serology to check for infection for MV. Whereas OPA, we only just have the post-mortem or a lung scanning. So Johne's disease is the next one. We're all fairly familiar with Johne's disease in cows, but Johne's disease also affects sheep. So this is a picture of a sheep's intestine. You can see it's really, really thickened. So that part of the intestine should generally be almost see-through. You should be able to read a bit of paper through it. But you can see it's really, really thickened and really yellow and angry looking. Sheep are a bit different to cows. Cows with Johne's will often scour, but sheep don't. They just waste away. They just lose condition. And we do have a blood sample for Johne's disease in sheep, so we can blood sample or we can test feces as well. So again, if there's any suspicious animals in your farm, it would be a good idea to screen them. Or if you just want to do, an overall screen, then we can do blood samples. That can be targeted to, suspicious animals that are losing condition or just a group of healthy animals, just to see if there is any evidence of exposure. Again, this will be picked up as a lamb and they'll develop disease later in life. This one here is CLA. So that is Corynebacterium lymphadenitis. So this is a set of lungs here, and you can see, I'll get my little pointer again. So it affects the lymph nodes, and basically the lymph nodes fill up with pus. So these are two lymph nodes in the middle of the lungs here. It doesn't only affect lymph nodes in the lungs. Often it's first seen because they've got big lymph nodes at the bottom of the jaw, and they can burst open and fill with pus. That's the tip of the iceberg. When you see the ones externally, there'll be a lot more lymph nodes internally that have also turned to pus. It's pretty infectious. It can be spread through contact. You have to watch at clipping time if they've got any external sort of, abscessed lymph nodes, then that could be, passed on if they're nicked at that time. And it'll cause wasting, if you've got lymph nodes looking like that inside you, that bacteria can seed off and cause other problems. And it also will just cause a lot of, it depends where the lymph nodes are that are affected, but yeah, wasting, respiratory signs, not a nice disease to have. There is a blood test for this one as well, so you can screen incoming animals, you can screen animals that you currently have to see if it is a problem. Okay, and I think this is our last iceberg disease. So Borders disease is a bit like BVD in cattle, so it's the same family of viruses, and it can cause abortion, it can cause congenital malformations. I don't know if any of you will have heard of the classic hairy shaker lambs that are born, where they have sort of congenital malformation of the brain. They tend to have a curly hairy coat and they just like vibrate all the time, and yeah, basically they're just not going to do. Those are pretty rare, but when you pick up a textbook to read about Borders disease, that's what they tell you about. But yeah, they're not very commonly seen. More commonly, this virus will just be circulating in a group of sheep and it causes immunosuppression. So because of that, you see increased disease. So you see more infectious lameness, more pneumonia, probably in younger lambs, more like parasitic gastroenteritis, so higher worm burdens because they're immunosuppressed. So it's basically one you just do not want in there because whatever you do, this is going to be pulling the immune system down. Any vaccines you give aren't going to be as successful. And yeah, we can blood sample to assess for exposure for this one, or we can blood sample to pinpoint the actual animal that's carrying the virus. So similar to BVD, you will get some sheep that are PIs and be, circulating the virus amongst the rest of them. So you can check a group of sheep for exposure, or you can, and once you've decided a group of sheep has been exposed, you can then go through them and check for virus and try and, pinpoint the PIs and remove them. So yeah, if you've got cattle as well, you'll be well familiar with that as a BVD control point, but border disease is the equivalent in sheep, and we do consider it as an iceberg disease because it is going to be pulling your flock down. And like I say, we've got blood samples available and the funding available to test for it. Yeah, so I mentioned cull ewe screens at the beginning of just talking about iceberg diseases there. Cull ewe screens are an invaluable way. Yeah, and apologies for the gory picture if anyone's still eating their dinner. They're a really invaluable way to assess what is in your flock. So we can do all these blood samples. Unfortunately, we don't have a blood sample for OPA, but actually getting into a carcass and seeing what's there tells us a lot. So if you've got ewes that are skinny for no other reason, so they've got all their teeth, they're not lame, there's a reason for them being skinny, and they are a prime candidate for sending in for a cull ewe screen. So we can either take them in live at any of the post-mortem rooms, or if you're close enough, you can get your vet to euthanize them on farm and bring them in. And we do a batch charge, so you get quite a good deal for sending in 4. And sending in more than 1 is really good to give us an idea of what's going on in the group. So, an ideal number is 4. If you just send in 1 and it's got 1 disease or we don't find in, then it doesn't mean that the rest of the group's okay. 4 is a sort of better number to have a look at. And yeah, it's also a really good opportunity to just check, does this group have a high worm burden? What are their trace element status like? Because we can check the liver for trace elements. Bearing in mind your cull ewes maybe aren't the best candidates for that because they are likely to have varied, if they've got another disease process going on, then their trace elements aren't going to be as similar to the healthy ones in the group. But we can use it for that purpose. But yeah, the main purpose is we can open up a ewe, we can check, has she got OPA, has she got CLE, has she got MV, has she got Johne's disease? And if you do that, and the answer is no, she hasn't got any of these, and you've sent us 4 ewes and they're all skinny and no, they haven't got any of these diseases, and that's a good news story. You've done your screening and you're like, actually, she doesn't have any of these diseases that she's going to be circulating around the flock. A lot of the ones we get in that we find no evidence of any of these iceberg diseases in have really bad cheek teeth. So although you can check the incisors and think, oh, she's got a full mouth, then sometimes they've got sort of abscesses or something at the back of their mouth, which you can't check in a live animal. So yeah, if you send us in cull ewes to do a cull ewe screen, if you don't get a diagnosis of disease, that's not a bad thing, that's a good thing. And even better if we find another reason for her being skinny. So like I say, we can take these at any of the postpartum rooms that we have and just get in touch with your vet if you'd like to go ahead and do that and find out costing, etc. So yeah, with iceberg diseases, you want to know, are they present in your flock? If you don't know, then find out, because knowledge is power. And if you don't have them, then take steps to keep them out. So, think about where you're buying in. Can I quarantine and screen these before they're added to my flock? And if they are present, make an action plan to try and reduce the impact on production. So you want to try and limit the exposure of lambs to, the infected group or the, older ewes that could be infecting them, because you want to try and stop that cycle of infection. And that is so different on every farm. So that's why you need, your vet or advisor involved to try and work out a plan specific to your farm. So that's iceberg diseases. Next one on my list is lameness. Now, I think this one could be too easily skipped over and think, of, my lame sheep. I just chip away at them, I treat them. But this is such a fabulous opportunity to stop and think, right, we need to do something about that lameness problem. Get someone on farm. And it's because I think lameness is too easy for you to treat at home, and you just chip away and chip away and chip away. And it's so pertinent to each individual farm. Each individual farm is different. This is an amazing opportunity for you to get a fresh pair of eyes. Fresh pair of eyes on a farm is invaluable to see where your risk factors are for lameness on your farm. Get some sheep in, have a look at some lesions, have a look at some feet, right? What is actually causing the lameness on your farm? Rather than just, treating it, chipping away at it. It never, it's never a massive problem, but it never goes away. So yeah, get your vet on farm, get some sheep in, have a look at their feet, what's actually causing the lameness, right? Okay, what are the risk factors for that on our farm? And how can we control it? What should we do about it? So really would be a really, really valuable use of time on a lot of farms. And I think the limiting factor often is obviously that time comes at a cost, but here's the money to do that. So yeah, if none of the other things are sort of sparking an interest, every sheep farm has got some lame sheep. So I think this is a prime opportunity to get, a fresh pair of eyes on to try and see if you can, sort out a plan to reduce that. Because it's labour intensive as well. Nobody wants to be sorting lame sheep's feet. So it would, save a bit of labour time and money as well in the long run. So the last two I've kind of lumped together, liver fluke and sheep roundworms. They're always in there somewhere, aren't they, with every every sort of sheep discussion. So this, we've changed organ now. This is not a set of lungs, this is a liver, and this is a liver from a lamb that's been infected with acute fluke. So if I get my little pointer out again, you can see here, this liver is very, very pale looking. So it's very, very pale looking. We've got a big pool of blood here and we've got a big blood clot here. So basically what's happened is these are immature fluke that have got into this liver and they've just basically made it go pop and it's bled out. And we used to see these a lot in the autumn. The picture is changing slightly with climate change, and that the last couple of years we haven't really had the acute fluke outbreak. But nonetheless, fluke is an issue. It will cause death. It will cause decreased production. So and here is a section of liver, probably from an older animal, and you can see these are adult fluke. So these are actually what burrow through the liver. And it's good to be able to visualize what fluke are actually doing, because it's all very well saying, oh, they've probably got fluke, but if you actually visualize, right, what is the fluke doing to that animal? Well, they're burrowing through the liver, causing liver damage, and that's what you see in either deaths or weight loss, reduced production. So how can we use this money to enhance fluke control? This is a really good infographic from the SCOPS website. So highly recommend everyone who's got sheep looks at that website at some point. Really, really good strategies for controlling worms and sustainable worm control. And the fluke module of this funding is open to any sort of fluke investigation. So the green line here is post-mortem, so that can detect fluke really, really early. So that along the bottom here, we've got a timeline. I'll point it again. So we've got a timeline along the bottom here. So a post-mortem will detect it really early, which is great. We don't want to be, killing every animal. We want to see whether it's got fluke or not. So we've got a blood test that's available, and it can detect basically from a couple of weeks post-exposure, which is really useful because I would recommend a lot of people use this for lambs over the summer. So just when you think you're going to get your first fluke dose out and dose some lambs, I really strongly recommend that you get your vet out and just take a few blood samples off half a dozen or so to see if they've been exposed, because the chances are they might be negative, because it was really late in the year this year when we saw our last year when we saw our first exposure to fluke in lambs. And by you not dosing them at that point, if they've not been exposed, then you've saved yourself a dose, so you've saved money, you saved yourself time, and you are saving that flucicide from building resistance. So it's a really, really good way to just try and reduce your flucicide use and use it at the right time. So I would recommend you bleed half a dozen lambs, starting in the autumn probably, just when you might be thinking about getting your first fluke dose out. Get them in, bleed them about a week before you might be wanting to do it, and then you should have your results back. And yeah, if they're negative, then you do not need to dose them because they've not been exposed yet. Other methods of checking up on fluke. So we've got the copper antigen ELISA, which is a test on feces, and it can detect immature fluke, whereas our fluke egg counts obviously need the adult fluke, so they need to be developed to adults before they're putting fluke eggs out in the feces. So that's obviously a late stage diagnosis, and they ideally probably want it treated before they get to that stage. So the copper antigen ELISA is a good one to do before that stage. But yeah, I think my take-home message from this would be, every time you get a fluke dose out, you should be thinking, do I actually need to do this? And in lambs, you can use the blood test. The blood test isn't so great in older animals because the chances are they'll have been exposed before, so they will test positive anyway. But a lamb has not been exposed yet, so it's really good to use in lambs. But yeah, even older animals, you should be doing a fluke egg count or a copper antigen ELISA to make sure that you actually need to use that fluticide. By doing that, you're going to slow the rate of resistance and save yourself a bit of money as well. And then lastly, for worm investigations, you can use them just for worm egg counts. Again, every time you get a wormer out, you should be thinking, do I actually need to use this? And to answer that question, you should be doing a worm egg count. Ask your vet. A lot of them will be doing them in-house, rather than sending them away to lab, so you can often get results back the same day or very quickly. And ideally, you want to be doing sort of a pooled egg count, or sample a few animals. You don't really want to just be sampling one animal, because that might be the one animal that's really high, or the one animal that's really low. So you want to be testing 10 or so, and they can be pooled and looked at under the microscope as one lot. So use it to try and knock out some worm drenches over the year. Again, they'll save you money, save you time, and will slow the rate of resistance down as well. It just makes worm control a bit more sustainable. You can use it, the funding, to check for worm efficacy. So if you're a bit suspicious that the last worm you used didn't really work that well, then you can actually do that test, the post-drench testing. So depending on what product you use, you would ideally take worm egg counts before you use it, give them the treatment, and then depending on what you use, you would either take worm egg count 7 or 14 days later. And you want to see a dramatic reduction in those eggs to prove that it's working. And that's really useful, because if you've got a wormer that's not working on your farm, if you've got resistance against it, there's no point in using it. There's no point in spending money on it. It's not improving your growth rates any. So it's useful for you to know that knowledge if it's not working on your farm. And with wormers, if you're suspicious something's not working as well as doing the egg count reduction test, then it's important to check you're dosing them for the correct weights, your dosing guns are calibrated properly, and you're dosing them where they should be. If it should be subcutaneously, then they're getting it subcutaneously. If it should be an oral drench, then that's where they're getting it. And obviously, usual caveats: make sure it's in date and it's stored correctly. All these can obviously be done without funding, but the funding is there to do the fecal egg count reduction tests, if that's something that you think would be useful to you. So yeah, that's me been through the 5 cheap options there. I really hope that at some point when I was waffling on there, a little light bulb went on and you thought, actually, that would be really useful to me. I really would encourage you to get in touch with your vets, speak to them about this. All the vets know about this. We've been discussing it with them. They're all sort of up to speed with the options available. And yeah, engage with your vet. Discuss what ones they think would be most useful to you. If you've got an idea, then go to them with that. They will be over the moon to be asked to be engaged. And the bottom line, we're trying to improve efficiency overall, but it's going to improve your bottom line if you can reduce your losses, improve your growth rates, whether that be daily live weight gains or increased milk production and use. And most of these, in fact all of these, sheep scab, iceberg diseases, lameness, fluke and worms, if you make marginal improvements in them, then they will improve your growth rates. improve your, number of lambs weaned and reduce your losses. So it is well worth engaging in. Yeah, you've got your £750 there if you haven't claimed last year, £500 if you did claim last year. So yeah, speak to your vet and speak to your local SEC consultants as well. And yeah, hopefully that's been useful for you to take home and sort of implement on your farm. And like I've said all along, these are all really farm specific. So there's not one thing that will fit every farm, which is why you need to sort of engage with your vet or advisor and just decide what fits your farm. So yeah, happy to take any questions if there has been any.
Brilliant. Thank you very much, Megan. That was really useful just to go through those different options and hear a little bit about what kind of symptoms you might be seeing if you do have any of those issues on farm. We have got a couple of questions that have come in. So the first question is about sheep scab, and the question is, we had to dip in November for scab, so how long should we wait before doing some ELISA testing?
Okay, so if they were confirmed as infected before they were dipped, they can remain positive for up to 6 to 8 months. So I'd probably be waiting until the back end of the year again before you do any blood testing, just to be sure, because it can muddy the waters if you sample them too early and they're still positive. Then yeah, you know that they had exposure. Saying that, you can back it up with scrapes as well. So you could, if you're still suspicious, you could do blood samples and you could do, wool pucks and skin scrapes. And if both are negative, then that gives you a bit of reassurance. If your blood is still positive and your skin scrapes were negative, I'd probably want to do some more skin scrapes, a month later or something like that, just to check that out again.
Okay, brilliant. Another question is just about clarifying about how many iceberg diseases can be claimed in the year. So I know you put up, I think you put up 4 of the iceberg diseases. How many can they actually do and claim for?
So it's £250 for the iceberg disease module. You can test for however many you want within that, but you'll get £250 towards your testing for any of the iceberg diseases. So you can test for them all, or you can test for one.
Okay, brilliant. That's ideal. Okay. So to claim for the first claim of the £250 for learning, what would you advise regarding what would be classed as learning and development, e.g. like joining a vet flock health club or attending meetings, etc.?
Yeah, just whatever is available in your area, really. Speak to your vets, they will know of things that are available. There's a lot of online things as well now, webinars like this. But yeah, speak to your vet, see what's available in your area. If there's farm visits or something happening further afield and you fancy a day out, then yeah, go for it. Use it for that sort of thing.
I think the key thing with that, and it's a question that I've had a few times from farmers, is that you're not going to be checked to see whether you've done anything with that £250 to go out and do any of attend meetings, etc. So don't feel like stressed about having to be able to prove that you've used that £250 to attend a meeting. So you can do things locally or attend meetings like this webinar tonight definitely counts as one of those development and learning. One of the other questions that we've had is just about, for example, and I can answer this one for you, Megan, is that with the PSF funding for so you can do a carbon audit and soil sampling as extra. And for the soil sampling, you do have to have done a carbon audit before you do soil sampling. Whereas with the animal health and welfare section, you don't have to have done carbon audit or soil sampling to claim that money. So that hopefully just clarifies that for anyone who's wondering. And if you were a sheep farmer, Megan, what would you be doing? What would your top 2?
My top 2
sheep.
I personally would definitely do a lameness review. because I think it is so easily overlooked because it never kills anything, but it has a
Mhm.
massive, massive impact on production. And it's just one of these things, you know, it's like, oh, we'll get to it, we'll get to it. Well, here's the money, do it. And I would definitely be blood sampling lambs for fluke before I put a fluke dose down their throats. They would be my top two that I would go for. But like I say, it's different on every farm.
Mhm.
And yeah, baby steps. You can't go and change the world, you know, in 1 year. Try and pick a couple and concentrate on them.
Yeah, definitely. And just a final question. If you are, say, for example, doing the blood sampling for the fluke in your lambs and they do come back with positive for fluke and you treat them, how long after treatment would you advise before taking another sample to see whether your treatment's actually worked?
So once they're positive, they will remain, there's no point in doing another blood sample because they've been exposed, they will be positive. And at that point, hopefully if you've caught them early enough, you are knocking out immature fluke, so those fluke won't be producing eggs. There's no point in doing a worm egg count. So you could do a copper antigen ELISA after you've treated them. And that would be 3 weeks after treatment that you'd want to do that to make sure it's worked. But you'd probably want to do one previously as well because we can look at the numbers to make sure it's reduced sufficiently as well.
And just finally, I would just like to thank you, Megan, for taking your time tonight to fill us in on all the sheep-related funding options. So thank you very much, and I hope that was useful to everyone, and we'll speak to you soon.
Yeah, thanks for having me. Thanks for coming, everyone.
No problem at all.